will start with the session. Today we are going to discuss about leading a healthy lifestyle, and we have three of our esteemed panelists here. Dr. Saeed Adnan Mohiuddin, who is a gastroenterologist, and he's MBBS and MD internal medicine and DM in gastroenterology and hepatology. Also has an advanced fellowship at the Mayo Clinic, USA in GI and pancreatology. We also have Dr. Bigesh Unnikrishnan Nair, who is a cardiologist, and he's a MBBS, MD, DM, and FACC and FSCAI from the USA. We have one more doctor who's going to join us shortly, which is Dr. Mohammad Samer Jamil. He's an urologist and also a surgeon in liver transplant. So primarily in today's session, we are going to cover on your heart, your liver and kidney. So all of these are the important organs for one's overall well-being. We'll start off with Dr. Saeed Adnan, who is going to walk us through his slides about the subject on gastroenterology. So over to you, doctor. If you could unmute yourself and start with your video as well. And we'll follow that through with Dr. Bigesh later on. While doctor is putting together his slides, I would also like all the participants present on this webinar to know that there is a way for you to ask your questions. You can type in your questions in the chat window, and you can ask any questions which you may have related to any of your health issues or anything. So we have a question and answer session towards the end, during which time these questions can be taken.
Hello. Hi, Sanket. Can you hear me?
Yeah, hi, doctor. We can hear you. We can't see you, although.
Yeah, I think you've blocked my video. Sanket.
Oh, okay. Sorry about that. Let me just unblock it.
Sure.
Okay. Can you try now, doctor?
Yeah, got you. All right.
So yes, doctor, you have your slides. You can get started with it.
All right. So hello, everyone, whoever has joined in. Happy World Health Day to everyone. Now I'm, as Sanket has introduced, Dr. Saeed Adnan. I'm a gastroenterologist. And I'm going to just talk about liver specifically today. And my focus is some of the conditions that can happen due to unhealthy lifestyle pertaining to your liver. And I will go through some tips and some lifestyle modifications that you can take to have a healthy liver and avoid some of these diseases as well. So the topic that I'm going to speak obviously is human liver and health and disease. So just to understand the scale of the problem, this is a sample from the UK. And if you see this graph, you can see that the death rate in the UK from 1970 onwards has just exponentially increased with regards to liver disease. Some of the other death rates with regard to other diseases such as stroke and respiratory as well as bloodborne diseases, diabetes has kind of plateaued, but the liver disease has kind of exponentially rocketed in terms of its death rate. And we'll see why this has happened. Just to understand the natural history of liver disease, some of the common conditions that can affect your liver apart from viral hepatitis, which is hepatitis B and hepatitis C, is alcohol. Right here at the end, it's alcoholic liver disease, and obesity causes something called non-alcoholic fatty liver disease, which is the major topic of my discussion today. Now, all of these conditions lead to chronic liver inflammation, which over time can lead to scarring in the liver, which is in other terms we refer to as liver fibrosis. And if that liver fibrosis is not reversed or is not attended to in the proper way and at the proper time, then it goes into cirrhosis or an end stage of liver disease. And without transplantation, that can lead to eventual death. So the spectrum of liver disease in fatty liver, or in other words, non-alcoholic fatty liver disease, is that fat accumulates in your liver initially. If you see the first part of the slide, it shows that you have fat infiltration. That means fat globules, they kind of infiltrate into your liver because of generalized obesity, hyperlipidemia, your cholesterol being high, and our sedentary lifestyle as such. Then sometimes the fat can produce inflammation. This is when your liver test would go up and you would see an increase in your liver enzymes, commonly referred to as ALT/AST or SGOT and SGPT. With time, this will eventually lead to a progression of your liver disease and scarring, or in other terms, cirrhosis. This is again the same slide showing some of these inflammatory mediators that act when your liver progresses from a fatty liver or steatohepatitis to a more advanced disease or cirrhosis of your liver. Okay, so what do we do to diagnose fatty liver disease? We do something very commonly done, which is an ultrasound. If somebody's really obese and has a deranged liver enzymes, we do an ultrasound to kind of find out how much of fat is infiltrated into their liver. It is kind of a crude method to diagnose it. We have more sophisticated methods such as elastography and fibroscan, which help us quantify how much of fat there is in the liver and how much of fibrosis that has already happened. If it is simple steatosis, meaning that your liver enzymes are normal, but just you have fat in your liver, we monitor your disease. But if your liver tests are elevated, that means that the progression of liver disease into more advanced stages, which we've just seen, the chances of that are much more higher. So we are more vigilant in taking care of you. Let's skip to the management of some of these issues, which is basically based on your lifestyle and managing of your metabolic syndrome, which means that managing your lipid profile, managing your diabetes and stuff. And then there is other management, which is liver specific, as well as management of the advanced disease. Now, coming to the important part of our discussion, which is lifestyle modification. So what lifestyle modifications can you take to prevent this fat from accumulating in the first place? And once you have accumulated and once you have established liver disease, what are the steps that you can take to reverse that? Now, the first thing that you can do is obviously to maintain a healthy body mass index or a healthy weight. Now, in established liver disease or in established fatty liver, we recommend all our patients to at least lose 10% of their body weight. It has shown in multiple trials and multiple evidence that it has a better outcome, especially when you have a fat infiltration already into your liver. Now, exercise regularly is the second step. Now, how much of exercise you should take when, well, no, the amount of exercise in fatty liver disease has been shown to be about at least 100 to 150 minutes per week to have a beneficial effect on established fatty liver disease. If you don't have fatty liver disease, it's always a good thing to exercise. No amount of exercise is high enough. As much as you can tolerate, it's always good to exercise. I should add that some of these diseases, especially gastroenterological, as well as my colleague in cardiology would agree, that they are related to the sedentary lifestyle that we have adopted over the years. And being in an office sitting for 8 hours is like the worst thing that we can do to our body. So what I advise most of my patients to come into my clinic is to at least take 3 to 4 breaks of 10 minutes each during their 8-hour shift. So if you have an office job or a desk job and you're seated in your chair all day, take at least 3 to 4 breaks of at least 10 minutes each. That's about exercise. And what should you eat? That's the second part. Always eat a healthy and a balanced diet. A wholesome diet consisting of good amounts of nutrients as well as minerals is very important. Avoid excessive sugars and high calorie foods. Avoid unnecessary medications and toxins. Excessive sugars and foods are all your junk foods, the foods that are fried and have a high amount of calories and high amount of sugars. They are a strict no-no, especially if you have established liver disease. Antioxidants, natural antioxidants are better. Omega-3 and vitamin E, I'll talk about their role in a minute. So science has informed us now about some of the foods that are beneficial to your liver. I'll just quickly go through them. One of the important components is cruciferous vegetables, which is broccoli, sprouts, and stuff like that. All kinds of fruits which are high in antioxidants are good for your liver. So these are all colored vegetables and fruits such as blueberries, beetroots, grapes. They are high in antioxidants and have a good outcome on your liver metabolism, as well as fatty fish such as salmons have been shown to be high in omega-3, which has a protective role for your liver. Now, most of these evidence has come from animal studies. So these are studies done in mice that have shown that when these things are included in their diet, their liver tends to perform well, and some of the fat that is established in the liver kind of regresses. Human studies are limited, but of course we can draw from these animal studies and try to incorporate them in our own lifestyle. Management of NAFLD in general should focus on managing your lipids as well as your glucose, your waist circumference. And as I said, weight loss of about 5 to 10% to improve inflammation and steatosis. Thank you, and I'll pass it over to Sanket now.
So thanks, doctor. It was wonderful to hear from you. This is all useful information, and we really feel that that we can implement some of these things for real in our life as well.
I hope so.
I'll just pass it on to Dr. Bigesh now. We'll just set up his machine for this. Till such time, if there are any questions, one of the things which I got here on the panel earlier was about fatty liver. You covered that part, but is it something which can happen only to fat people, or is it only with rather with obese people, or could it happen possibly to somebody like me who is lean and mean?
Well, I don't know about mean, but you're definitely lean. What I would say is this is an important question, Sanket, and we are now seeing more and more lean people getting steatohepatitis, meaning fatty liver. And when we are seeing this, it happens that the lean people have more deranged liver tests. So obese people get fatty liver, but the liver tests are normal, but the lean people get fatty liver and their liver tests are deranged. So we call it lean NASH. That's the term that we use in medical terminology. And we are seeing that this is a sign that the liver disease can progress more and more. So the answer to your question in short is that fatty liver does happen more in obese people and people with high BMI, but lean people can get it too. And when they get it, it is in other words, more dangerous because the progression of liver disease happens more and more in them.
All right, doctor, can you stop sharing your screen now so that Dr. Bigesh can then share his
All right.
screen?
Sure.
On the top, there is stop sharing.
Okay. Oh. Okay. Okay. Stop share. Oh, where's that? Okay. Now I think we are seeing Bigesh's screen now. Dr. Bigesh. Yeah.
Good evening, all of you. COVID-19 pandemic has given us great opportunity to reflect on what is important in life and how we should best take care of us and our planet. I am Dr. Bigesh, consultant cardiologist in Naseem Healthcare. Today, I will be mainly dealing with cardiology segment. My other two colleagues are here. Already one colleague is over with gastroenterology, and Mr. Samir will be taking up with the urological health. Health, as you all know, it is not only physical, but mental and social well-being. Cardiovascular disease is the #1 cause of death on the planet, even though there are different types of heart disease, such as heart rhythm abnormalities, cardiomyopathies, valvular heart disease. The preventable form of heart disease by lifestyle is atherosclerotic cardiovascular disease. Atherosclerotic cardiovascular disease doesn't only mean coronary artery disease, which affects the heart. If the blood flow towards the brain is disturbed due to narrowing of blood vessel due to atherosclerosis, we'll get ischemic stroke. And if the blood flow towards the legs are affected due to narrowing of the blood vessel, we'll get peripheral arterial disease. Heart is the most hardworking muscle of our body, which pumps 4 to 5 liters of blood every minute during rest, and also supplies nutrients and oxygen-rich blood to all body parts, including itself. Coronary arteries are arteries which supplies the blood to the heart. So this is a picture which shows both the left as well as the right coronary artery. Visible now? Is it visible?
Yeah. Dr.
Syed, you can see the screen? Okay.
Yeah, Bigesh, we can see
Visible?
you.
Yeah.
Yeah, we can see you, Bigesh.
The screen is visible, the screen?
Yeah, it is. Go ahead. We can see your Netter diagram.
Yeah, okay. Yeah, these are the fluoroscopic pictures of the left side as well as the right side, right coronary arteries. And this is a normal vessel which contains 3 layers. One is the tunica adventitia, media, and intima, which is a normal vasculature. And when the fatty deposits build up inside this can cause narrowing of the blood vessel, producing when the narrowing is significant enough, more than 70%, patients will start developing just discomfort on exertion as well as dyspnea on exertion. So the risk factors of heart disease or the myocardial infarction or maybe coronary artery disease or atherosclerotic cardiovascular disease can be classified as modifiable as well as non-modifiable. Non-modifiable risk factors like age, gender, race, and family history, we can't do much on it. But the modifiable ones, definitely, as with lifestyle modification, we can definitely reduce our risk for the coronary artery disease. What are the risk factors? High cholesterol, high blood pressure, uncontrolled diabetes, smoking habit, obesity, alcoholism, physical inactivity. So these are the modifiable risk factors. So risk factor screening actually should start from the age of 20 years. Because as early intervention we can do, the results are much better. And all adults definitely after the age of 40 should know absolute risk of developing their own risk of coronary artery disease. We have certain applications such as the Framingham score, which you can download from the internet, where you can see if you can put your age, your gender, the cholesterol values, whether you smoke or not, your systolic blood pressure values, as well as the medicines which you are taking for your blood pressure, you can yourself analyze your 10-year risk of getting a myocardial infarction or coronary artery disease. For a diabetic patient, what always we should remember is this is one of the biggest risk factors of heart disease, because diabetes is equivalently considered as a cardiovascular disease, because at any given cholesterol level, diabetic persons are at higher risk of heart attack or stroke. A diabetic is more likely to die of a heart attack than a non-diabetic, and 80% of the diabetic definitely usually die with a heart disease. Obese have definitely 2 to 6 times the risk of developing heart disease, especially the apple-shaped body. That is more fat, which is being, maybe our gastroenterologist has already discussed on this part, that over the abdominal region, especially the internal organs, definitely have a higher risk of getting into getting a heart disease, especially coronary artery disease. Coming to how to prevent the heart disease, always what you should remember is look before you eat. That means eat at least 5 servings of fruits and vegetables daily, and especially colored vegetables and fruits, and go for grain products, whole grain products, non-fat or low-fat products, lean meat, as well as fat-free milk. You try to use olive oil as salad dressings, and only one diet is proven to prevent the cardiovascular disease. That is a Mediterranean diet, which includes all the things what I've already told you now. Limit your intake of food high in calories and low in nutrition, including food like candies, soft drinks, junk food. Limit food high in saturated fat, trans fat, and cholesterol. Try to use less than 2.3 grams of sodium chloride, that is salt, a day. As well as try to maintain, the second most important thing is regular exercise. That is at least 30 to 40 minutes of daily moderate activity. That is fast, even a brisk walk is more than enough, rather than going to the gym and doing heavy exercise or anything, because which has its own a negative risk also is there. So always try to do a brisk walk. That is more than enough, which is very much helpful in reducing the incidence of obesity, increasing the HDL, as well as HDL is good cholesterol and lowers the LDL, which is bad cholesterol, and also help control of diabetes as well as hypertension. Stop smoking. This is very important thing which everyone should understand. The most of the youngsters, especially in Qatar, what we are seeing, who smokes, usually they are into high risk of coronary artery disease. Smoking prevalence in Qatar is very high, and the young population who are working, the expats, maybe because of multiple reasons. Most common reason what everyone tells is stress. But smoking is not the thing to relieve stress. Smoking is something which is very much deleterious, which can result in not only heart disease, lung cancer. And if you see, even recently we had a patient of 22 years who had come with history of chest discomfort and was seen in a periphery and was treated with antacids. And or later on, when he came here, we took an electrocardiogram, which was found to have an ST elevation myocardial infarction. And the only risk factor in him was smoking and a family history. So smoking we should definitely take as a something which is very much prone to result in coronary artery disease. And quitting smoking definitely help you within the first 24 hours itself. And after nearly 1 year of quitting, the cardiovascular risk decreases significantly. And within 2 years, it reaches the level of a non-smoker. And this is very important. Always know your numbers. What sugar is the best for you, what cholesterol value is the best for you, what is the best blood pressure value which you should have. All these values and numbers are very important in everyone's life. But for everyone the numbers may not be the same. For example, here the LDL less than 100, this target is only for a diabetic patient. But for a patient who had a heart disease or patient who is at a risk of heart disease, the LDL should be less than 70. And if there is high risk post PCI and all, the LDL should go down less than 55. Lower big LDL, which is the bad cholesterol, the better for the patient. 10% reduction of blood cholesterol itself produces 20 to 30% decline in the cardiovascular death. And all adults greater than 20 must get tested early to recognize their risk of having high cholesterol. And to tackle it is very easy by taking a single dose of medicine itself can bring down your cholesterol to normal value. And it can help you over a long term if you even have a history of familial history of hypercholesterolemia. Controlling blood sugar, controlling blood pressure, all these are very important. And all the numbers, as I have described, the blood pressure should be around 120/80, which is the normal blood pressure. And if on a patient who is an hypertensive, should be less than 140/90 is the cutoff. We should keep it at less than 140/90 at least. And the most important thing which I would like to discuss on this day is the psychosocial factors. Everyone who is working, almost the expats, this is a talk which is mainly listened by expats, that is what I understand. And who are here are lonely, their family will be, most of them will be there back home. And the most important thing is, after the COVID-19 pandemic, what we are seeing is a stage of panic attacks and depression. And most of the people who come, around 30% who comes to the cardiology OP, are post-COVID patients who are very much panic and who are feeling as if they have a problem secondary to COVID, the palpitation or any chest pain or anything like that. They are very much worried about their health. We have a study which suggests that social interactions with close friends, interaction with family, will increase the happiness as well as will have a long life without uh, much diseases like coronary artery disease and all, if you have social interaction as well as a good relationship maintenance. Another important thing is stress management as well as an adequate sleep. Stress management, we know meditation as well as breathing exercise do have a role to reduce the stress. And sleep, very important. Adequate sleep is very much necessary. The most important thing is the melatonin, which is a hormone which helps to sleep, is maximum between 11 p.m. and 6 a.m. And at that time, using a laptop or a computer or being with using mobile phones, all these things will actually decrease the melatonin secretion at that time and cause inadequate sleep. That itself can cause increased sympathetic tone, and which can lead to the symptoms of cardiac issues. So these, I am, without wasting much of the time, the thing which need to be conveyed to you is, find way to incorporate heart healthy habits in your lifestyle, and you may well enjoy a healthier heart in the years to come. Thank you. Thank you very much. If there are any questions, or questions may be asked at the end of the session as a panel discussion. Okay, is that's also fine.
Yes, yes, doctor. So thanks. It was quite enlightening, doctor. It was wonderful to have all your inputs for managing our healthy heart. Next, we have Dr. Samer, who is a urologist, and he is also a kidney transplant surgeon. Dr. Samer here is going to help us understand a little bit more about the kidney function and how to maintain the kidney health by eating appropriate diet and with certain other activities like exercise, or what to avoid, what not to avoid. So Dr. Samer, over to you. Your presentation can be put on the screen now.
Hello, everybody. This is Dr. Samir. Welcome, doctors and our guys. So today we want to highlight about something important. It's the most important after the heart uh, organ in the body, and the liver. Don't be worried, doctor. Heart and liver is also important because one is the pump, is doing everything, and other one is removing also most of our waste from the body. And the kidney is the second part that we can remove all the waste. It is the most important thing in our body, like an organ that remove the waste by filtration, your blood from all waste, the blood running from the heart all the day, and the kidney also working all the day just to remove the waste. It's like form of urine it's giving out from the body. So this is like in every one kidney there is about 1 million. It's called glomerule. These glomerulus, it's a very tiny, small vessels that it's filtrate your blood from the waste. What waste? This is our body is taking the blood and all salts like potassium, sodium, and calcium, and other like phosphorus. This need to filtrate and to take the benefit from this and to throw out the waste from the body. So our body have balance. This is balance is do it for electrolytes by kidneys. And what others, it removes, it's filtrate also. It takes the protein inside the body and doesn't get out the sugar from the body. It's also the sugar inside the body. Sometimes we will see here the anatomy of our body. This is two bars of kidneys behind our uh, back. So this is the most important. It's the kidney that it's also not just filtration. It's also have some regulation in the bodies like blood pressure. It's secretion of renin that it will also control our blood pressure. Also, it's play a big role in bone density, like playing a role in vitamin D composition. And other one is secretion erythropoietin that also play roles in our bone marrow to make blood cells. Even this is also some like for heart regular, yeah, in some it's like high blood pressure or some low blood pressure. So the kidney is making some playing in hormones that elevated or down the blood pressure. So what's most important to go for this kidney to make it healthy? So this is a lot. First of all, these things, it's a water. We all know that the water composition of our bodies is about 70% of our body is water. So we need the water. All the times we need the water. Water, it's just not for the kidneys. We are breathing also. After breathing, there is a water. We are eating, also we need water. This is to digest all these foods. So water is most important. There is a foods that's full of water. It is very good. Now we are in Ramadan. Who's fasting? yeah, on all these months, he needs a food that contains water, like watermelon and other foods also. So these foods contains a good minerals, and it's very good for your health of the kidney. So we can take more of these foods like juices, yeah, and or foods. It's very beneficial for our kidneys. But the most important here is a water, and what we can avoid for the kidney is not healthy. It is just this is some several things that harms your kidney. It's excessive salts, like some medication that like analgesic, pain relievers. When somebody is taking from outside for no reasons or just for headache or anything, yeah, or he likes to take it without consultation of the doctors. These painkillers like ibuprofen or Voltaren or any another non-steroidal anti-inflammatory also harms the interstitia of the kidney, not the kidney by itself, but interstitia. So it causes interstitial nephritis, and it is not be seen by regular test. We must do sometimes special test to know that it's having like this issue. Though the patient mustn't take his overdose or over-counter treatment, he must go to the doctor and to check if he have any pain in the kidney, or he have any blood in the kidney, or he have changed the color of smell of the urine. So what we can also do for this one, we want to be happy and the kidney will be happy. So first we can reduce the salts taken. Usually a cardiologist now, he recommended that 5 or 6 milligram is enough in all the day in 24 hours. The salts, we can change it to potassium if the patients have no a kidney failure or something like other causes that make potassium. Potassium, it's a good for the heart, yeah, but it's not good when we have sodium. So our treatment is a restriction of the salts, not more than 5 grams. So the other one is just cease smoking also, because smokes it's make constriction of your vessels, as the doctor said, and it's cause atherosclerosis, and also is making too much toxins that excretion in the urine also is make cancers in the kidney and the urethral and all the excretory system. So why we must be active? Activity is essential because all our filtration is depends on your blood pressure. If you have a regular blood pressure is good, it's about 12, so will keep your kidneys functioning. If you have a very low blood pressure, it's down about 9 and down, so it's maybe low. This depends also in the person. But regular good blood pressure, it's safe, your kidney is good, yeah, and the activity is running the blood in your vessels and improve your filtration. So what we will do for our hydration, we will always must to drink about 2 to 3 liters of water. In Ramadan now we are after fasting, we cannot drink directly after food because it's make digestive problems. So we must take a little one just after food, maybe by 2 hours. We can start by drinking a lot of water every 1 hour. Maybe we'll take one glass of water. So after to the suhoor, yeah, we must take about 2 liters minimum, yeah, water, and avoid caffeine. It's also is making like diuretic effect that it's making you too much going to toilet. So this is for health of the kidney. If any questions, I will be happy to hear from you. Thank you.
Doctor, there is a question which I received here. Well, you've spoken about the water intake, but is it advisable to drink immediately after meal, or during the meal also there is an habit to sip water by the side? So how does it, how does one or the other help, or does it not, is it not recommended to have water while eating?
So some people with eating, they are drinking water. It is bad habit. Even they are taking juices or something others with the eating. This is also harmful for your digestion, because you have stomach and you have hydrochlorides. It's from your stomach. It's digest by itself. So we must wait about 2 hours after meal to take water. But if you are too thirsty or the food is very dry, you can, of course, you can take a little water with the food, but it's not mean that you must drink a lot of water, because you see that some people is drinking and eating. Even these soft drinks, it's very bad. With sugar or something like gases is very bad for the stomach, and also for your kidney, because some of them is also containing phosphorus that affects some kidney functions who have borderline kidney function.
Doctor, there is another question related to cardiovascular health. So are frozen foods a problem for health, for our cardiovascular health? That is another question which came in.
Always taking fresh food is recommended. Regarding the frozen food, more I think Syed Adnan will be able to give you more insight into it.
Yeah, I think, thanks, Bigesh. I think about the water as well, Sanket. This is a very important thing, and thank you, Dr. Tamer, for touching on that. It's an absolute no for your digestive system. The reason is when you eat, that food that goes into your stomach, it makes your stomach, the accommodation goes away in your stomach. So your stomach doesn't accommodate after food enters there. So it kind of becomes a rigid structure there. And when you drink a lot of water, the water inside kind of creates a succussion splash within the stomach. So it creates a lot of bloating and all, and it drives all the food that you have taken down into your duodenum and beyond. So it prevents good digestion. It prevents good mixing of the acid along with the food. So yes, water along with the food is an absolute no, as my urology colleague has suggested. And the other part about frozen foods is that is absolutely, again, one of the main drivers of high cholesterol, as well as toxins entering your body, is all these preservatives that are there in this frozen food. So if you study this mechanism, how food is frozen and how it is preserved, you see a lot of these preservatives that are added to these foods, especially meats. And over a long, and they add not just preservatives, but a lot of salt as well, which is not good for your digestive system as well as your kidneys. And it creates over a period of time chronic conditions such as diabetes, hypertension because of the salt, as well as toxins, which are sometimes creating metabolic syndromes and all sorts of bad effects on your digestive system and your overall health as well. So as Bigesh is suggesting, the mantra to a healthy life is to eat healthy, and that healthy eating is fresh, home cooked food. Time and again, we come across many experts saying the same thing. All this research we have done over years has pointed out that home cooked food, when compared to hotel cooked food and stuff like that, and fresh food compared to preserved and frozen food, is much better.
All right, Doctor, on this topic, there is one question which has come in from the audience. What could be the best diet for dinner after they turn 40? That's I mean, I would rather say that the person must come and consult with a dietitian at Naseem Medical Center. That could be one option, but just to give a precise answer, do you think anything in your mind?
Yeah, so what I would say is eat wholesome, avoid red meat during your evenings. You can have that during your lunch or lunch times. Avoid excessive red meat during your evening. Avoid high protein food during your evening. Eat light and have a break of at least 2 to 3 hours between the time you eat and you lie down, to decrease the digestive effects of reflux and stuff like that. So that's what I would advise. It's always a good habit. I am sure Bigesh will agree with me that it's a good habit to take a small walk or a little bit of an exercise after your dinner to kind of help digest whatever you've eaten. But my recommended advice is to be light on your dinner and be heavy on your breakfast and lunch. So the age-old saying of have your breakfast like a king, have your lunch like a miser, and have a dinner as a beggar is an absolute true saying.
And try to make it one more added comment on it. Try to make your dinner little early, maybe. Don't delay it. Always try to make it at around, maybe possible around 7 o'clock or 7:30 if possible. And try, as Dr. Adnan has told, maybe after an hour of having a dinner, you can have a light walk. Definitely, yes. That will add on to your sleep part also.
Thank you, Dr. Bigesh.
There's another question related to multivitamins, or things like having omega-3 for your liver health. So what would you say on that, doctor?
Yeah, so we have evidence that omega-3 has a good effect on your cholesterol. We don't have robust evidence that suggests that omega-3 is good for your liver. It's a natural product. You can take it. What I advise is, instead of taking supplements, it's always a good idea to take natural source of omega-3, which is natural fish, which are high in omega-3. Salmons are a typical example. There are many other sources of omega-3, such as nuts and all. Natural sources of these vitamins and minerals is much better than artificial sources. The only artificial vitamin, or a supplemental vitamin, I should say, that has been shown to be effective in fatty liver disease is vitamin E. So if somebody has fatty liver, I usually prescribe them, in non-diabetic fatty liver, I prescribe them 3 times a week of supplemental vitamin E.
All right. Dr. Samir, for you, from the point of view of kidney function, there are a lot of remedies around having any kind of supplements, etc. Are there any supplements in specific, Dr. Samir, for improving the kidney function?
Usually, supplements for the kidney, there is no particular. If you have some decline of the function of the kidney, you must take supplements. But usually the kidney, it's by itself, it doesn't need any supplements. It takes all from the body. But vitamins, as Dr. said, Saeed, you can take it from the fruits. We mentioned a lot of fruits that you can take it, but not the fruits that it's rich with some salts. Yeah, that's the patients usually who is not diabetic, not hypertensive, can eat everything, yeah, for our kidney. But the most important is to reduce the salt. That's why. But supplements, there is no particular supplements for the kidney. If the patients have decline function of the kidney, he will have complication of that one, like loss of vitamin D, fractures, low density of the bone, have multiple issues. But if he is good function of the kidney, so just to drink water, have exposure to the sun, because you don't need vitamin D. Your body is already have it from the sun. Here in Qatar, most of patients have low vitamin D. So have your vitamin D is normal and exposure yourself to the sun. It will be important. Other things, the kidney function, like erythropoietin, who is making your red blood cells from bone marrow. It's also, if you have normal kidney functions, also it will be from the body is taken. No need to take from outside. Who have some affection of the kidney function, we will give him erythropoietin to increase his blood marrow to give more blood cells. So no need, just drink water, eat healthy food, move very well. Yeah, this is all for the kidney.
Thanks, doctor. I think our audience here is largely in the age bracket of 40 upwards. So there is another question which is kind of about the changing dynamics of human body once it crosses 30, and then thereafter after 35 it undergoes another bit of change, and once you hit 40 it's completely different. So the impact of our diet, that's what the question is, that if we are looking at, say, having meals at appropriate times, but if we skip meals or because of our schedules, then a lot of times acidity and things like that develop. Are these also leading indicators for gastric problems, or this is just because of our eating habits?
Yeah, so that's a good question, Sanket. If I understand it correctly, let me try to answer it in a few tips. Now, the first one I would recommend is, this sedentary lifestyle. We should all stop being sedentary. So if you come to my clinic, I'm sometimes standing and seeing patients. We have gotten into this 8-hour shift routine where we are seated all day, and this creates a lot of problems. So what I advise my patients is take at least 3 to 4 breaks during your shift, 8-hour shift, and use that break to take a 10-minute walk. Okay, so that's the first bit of advice. The second is try to be regular with your meal, not be erratic. If you are regular, then your digestive system gets used to that timing of food being dumped into it, and that creates a healthy digestive environment. Okay, without going into details. Then third one is eat short meals multiple times rather than eating a huge amount of food at one time. So this habit of working for 8 hours, going back home and eating all the day's food in 5 minutes while watching TV, that's a strict killer. So that is the other habit. That these 3 habits, probably if we get rid of these 3 habits, by far we might end up having a lot of reduction in some of our digestive problems, this bloating, flatulence, reflux, and all these abdominal pain and all these symptoms.
Got it, doctor. I think we have one last question which we can take, and this Dr. Bigesh can answer. Someone who has not exercised ever in their life, and now after they have reached 40, they start realizing that they are pretty slow in terms of taking any kind of even walks, or forget about going for a run. So what really does the heart go through at this stage when it's not used to this exercise regime, and how could one overcome that and yet while they are 40 could continue to exercise and do more?
First of all, better early than late. Try to at least have a brisk walk daily for 30 minutes for sure, because we have seen that especially as we age, we do have our body has wear and tear as its own level, and we usually start becoming little bit exercise intolerance happens to us, and we may not be able to do equally as our colleague who will be doing a regular exercise. And we do get people who complain of difficulty in breathing while climbing stairs, and if we analyze, most of them are not having heart disease. It is because of exercise intolerance or exercise. They are not doing exercise on a regular basis. First and the foremost thing is never ever miss an opportunity to do an exercise. At least have a regular walk, especially with friends if possible. Just walk, talk, and indirectly it will bring happiness. Not only happiness, but it also bring a long life also. This is a recent study which I earlier discussed with you. That is, if you have social commitments, and as well as if you are having more friends, and if you are being friendly with more people and maintaining a good relationship with not only family members, with friends, we have a study which has proven that you are going to be more happy and going to lead a more happy and long life without much disease. So let this message go across to everyone, and let us all pray on this day that we all lead a healthy and a happy life.
There is
without much
one thing which also came up, doctor. I mean, these inputs that you are providing are really wonderful, and it certainly is helping all of our audience here. Of course, we can have more such sessions and have more elaborate conversations on specific subjects. But one thing which came up just while you were talking, and earlier also Dr. Samir covered about exposure to sunlight. Now, what is the best time is the question, because there have been different people suggesting different things. So what, according to the panel, do you think is the best time to expose to the sunlight?
The best time is actually 11 to 12, but it is not possible in Qatar, to tell you very frankly. But and that too, the exposure should be and we are all wearing dresses and all. It is very difficult to get a good exposure. So it's always ultimately we end up taking vitamin D for sure. We have almost, if we see around some 50 patients, almost nearly 35 to 40 patients are having vitamin D deficiency. So this is something, unfortunately, this is the truth that they end up taking vitamin D supplements for sure.
Thank you. So, we have run short of time, exactly 4 o'clock. I'll firstly like to thank all the doctors, Dr. Samir, Dr. Bigesh, Dr. Saeed Adnan, for your time. And on behalf of Naseem Medical Center, I'll also like to thank all the participants who made time to join this session. We have participants from various corporations and even individuals who've joined in this session. So thank you all for joining in. We look forward to having more such discussions for you. In case you have any follow-up questions, you could certainly visit us at Naseem Medical Center. All the 3 doctors that you are seeing here on the screen are available at the Searing Road branch. Dr. Bigesh and Dr. Samir also visit our Rayan branch. All of these doctors can certainly help you and guide you through the journey. Once again, thanks a lot, everybody, for joining in. Take care.
Thank you. Thank you.
Thank you.